Imagine if you had the ability to shield yourself from one of the most deadly cancers affecting men today. Prostate cancer is a quiet threat that claims thousands of lives each year. Yet, it's a condition that can often be avoided when detected early. Before we go further, if staying ahead of serious health threats matters to you, hit subscribe and turn on the bell. This channel brings you life-changing tips you won't hear anywhere else. According to the National Institutes of Health, prostate cancer stands as the most prevalent cancer among men. In the United States, it's ranked as the second major cause of cancer-related deaths in men. The startling truth? 1 in 8 men will be diagnosed with prostate cancer during their lifetime. And in 2024, over 30,000 men lost their lives to this disease. In 2025 alone, more than 100,000 men in the U.S. are projected to receive this diagnosis. However, there's some encouraging news. Prostate cancer does not need to be a fatal sentence. If you recognize the early warning signals and respond quickly, you can greatly improve your survival chances. The issue is that most men ignore the prostate gland until it's too late. The prostate gland is a walnut-shaped organ found in males, located directly below the bladder and in front of the rectum. It wraps around the urethra, the tube that carries both urine and semen from the body. It produces a liquid that comprises about 30% of semen volume, helping to nourish and protect sperm cells during ejaculation. The prostate is also vital for muscular contractions during ejaculation, highlighting its critical role in reproduction and fertility. In this video, we'll reveal the 12 early warning signs and symptoms of prostate cancer that are frequently missed. These subtle signals can easily slip by unnoticed, but identifying them could be the difference between life and death. So, if you're over 40 years old or you have a family history of prostate cancer, this video is essential for you. First, let's discuss what you need to know about prostate cancer. Despite how widespread it is, many people remain unaware of the earliest signs, which often leads to delayed diagnoses and more complicated treatments. Sadly, the lack of open discussion about prostate cancer only increases its risk. When it comes to prostate cancer, did you know that aging is the biggest risk factor? The odds of developing prostate cancer rise dramatically after the age of 50, and it's most often found in men over 65. Here's the most disturbing part. One of the most misleading features of prostate cancer is that it can progress silently, with no obvious symptoms in its earliest phases. However, as it develops, it may produce a range of symptoms, from urinary changes to pain in the pelvic region. Understanding these symptoms and knowing the importance of routine screenings can drastically raise your chances of catching the disease early and getting effective treatment. Now, let's look at the 12 early warning signs and symptoms that can help you identify prostate cancer even before undergoing a medical exam. After we review these 12 symptoms, we'll also explain the typical causes of prostate cancer so you can lower your risk of getting it. Don't skip that section. Sign number 12, blood in urine. Have you ever noticed blood in your urine while urinating? This concerning symptom, called hematuria, is one possible warning of prostate cancer. It might look like pink, red, or dark coloring in the urine, and sometimes it's only detected by microscope. The presence of blood usually indicates more advanced prostate cancer, making it extremely important to seek medical advice immediately. While other problems like urinary tract infections or kidney stones can also cause hematuria, it's crucial not to overlook this symptom. Early discovery and therapy can improve outcomes, so keep a close watch and be proactive about any changes in your urination habits. Number 11. Difficulty urinating. Do you struggle to urinate? This warning can appear in several forms. You could find it hard to start urinating, experience a weak or stopping stream, or feel like your bladder isn't completely emptied even after going. Here's why this occurs. Prostate cancer can put pressure on the urethra, making it more difficult for urine to flow freely. Type 1 if you're still here, and hit the like button if this information could help save lives. Number 10. Inability to urinate while standing. Imagine this moment. You go to use the toilet, but suddenly you find it difficult or impossible to urinate while standing. This uncommon change can be disturbing and uncomfortable, pointing to a more serious hidden issue. When prostate cancer affects the prostate, it causes the gland to enlarge. This larger prostate may press against the urethra, blocking the urine flow. As a result, some men have trouble urinating while standing and may choose to sit instead. Number 9. A strong burning sensation while urinating or during ejaculation. Do you experience a burning feeling while urinating or when ejaculating? This unpleasant sign, which can vary from mild to severe pain, may mean that the cancerous tumor in the prostate is agitating or compressing the urethra and nearby tissues. Here's something crucial. This burning sensation isn't just painful, it may also signal inflammation inside the prostate. Although other conditions, such as urinary tract infections or prostatitis, may cause similar pain, you shouldn't ignore the chance of prostate cancer. Ongoing burning when urinating or ejaculating requires prompt medical attention. Number 8. Frequent urination, especially at nighttime. Do you often notice yourself waking up throughout the night to use the bathroom, leaving you drained and tired? Frequent urination at night, called nocturia, can interrupt sleep and contribute to ongoing weariness. While it's common for nighttime bathroom visits to rise with age, a sudden or clear increase shouldn't be ignored. Since prostate cancer causes the prostate gland to become enlarged, it can press against the bladder and urethra. This added pressure can result in a stronger need to urinate more frequently, especially at night. You may find yourself getting up multiple times, disturbing your sleep, and feeling more drained during the day. Before moving forward, if you're appreciating this video and want to stay up to date on important health topics, be sure to hit the like button and subscribe to our channel. Your well-being is valuable. Number 7. Unexplained weight reduction. Were you aware that unexplained weight loss may be a subtle but worrisome indicator of prostate cancer? This symptom is often missed because it can relate to other causes, such as stress or dietary changes. However, if weight loss occurs without any deliberate changes to your diet or activity level, it's essential to take notice. Prostate cancer can bring about unexpected weight loss, particularly in later stages when the cancer has spread elsewhere in the body. This happens as the body's increased energy needs and the cancer's impact on metabolism can cause noticeable slimming. Number 6. Pain in the bones. Another important clue to keep in mind is pain in the bones. Often, this discomfort is constant and not associated with any clear injury. Here's why this matters. As prostate cancer progresses, it can move to the bones, resulting in significant ache. This type of discomfort is usually noticed in the spine, hips, or ribs, and may vary from a dull throb to sharp stabbing pain. Interestingly, bone pain linked to prostate cancer doesn't disappear on its own and may be a clue that the cancer is at a more advanced stage. Number 5. Tiredness. Do you constantly feel exhausted, even on days when you haven't done much? This could signal prostate cancer. The fatigue might develop gradually or hit suddenly with full force. Fatigue in prostate cancer is more than just regular sleepiness. It's a persistent tiredness that doesn't go away with rest. Here's what's most concerning. Cancer-related fatigue is usually far more severe than normal tiredness after a busy day. It happens due to the body's reaction to cancer itself, the energy needs of tumor growth, and sometimes as a side effect of therapy. Number 4. Blood in semen. Imagine the shock and concern of seeing blood in your semen. This worrying symptom can leave anyone feeling exposed and uneasy. Called hematospermia, blood in semen can be linked to prostate cancer, as the cancerous growth inside the prostate disrupts delicate tissues and small blood vessels. This disturbance can cause blood to enter the semen, leading to a pink, red, or brownish discoloration. Hematospermia can also follow prostate cancer procedures such as radiation or surgery. However, if you observe this symptom frequently, reach out to your healthcare provider for a complete evaluation. Number 3. Weakness, numbness, or tingling in the legs or feet. Did you realize that prostate cancer can sometimes cause symptoms that appear unrelated to the prostate gland? One such symptom is weakness or numbness in the legs or feet. This can develop if the cancer extends to the spine, putting stress on the nerves that manage movement in the legs. When this happens, men might feel weakness, numbness, or tingling sensations in their lower limbs, making it hard to walk or maintain balance. In some instances, this can be so serious that it causes paralysis or loss of bladder and bowel function. Number 2. Pain or discomfort in the pelvic region, lower back, or upper thighs. The body is a complex network of connected systems, where issues in one spot may impact the entire body. With prostate cancer, pain or discomfort in the pelvic region, lower back, or upper thighs shows how interlinked the body really is. As prostate cancer spreads, it not only affects areas close by, but can also reach the bones and lymph nodes. This spread causes swelling and inflammation, placing pressure on delicate nerves. As a result, pain can radiate from the pelvis to the lower back and upper thighs. Number 1. Erectile dysfunction. Are you experiencing trouble keeping a firm erection? Erectile dysfunction, also known as impotence, is the inability to get or maintain an erection solid enough for satisfying intercourse. While multiple factors can cause this issue, it may also indicate prostate cancer, especially when it appears for no obvious reason. Here's something vital. Treatments for prostate cancer, including surgery, radiation therapy, and hormone therapy, can harm the nerves and blood vessels responsible for erections. This damage may result in erectile dysfunction, even if the cancer isn't the direct source. Are these symptoms opening your awareness? Type 1 if this is useful, or 0 if you'd prefer a breakdown on prevention strategies next. Your comment helps shape upcoming content made for you. So, what about the causes behind prostate cancer? Learning about them can greatly increase your chances of preventing this condition. Let's explore deeper. What triggers prostate cancer? Prostate cancer is a complex condition with various contributing factors. Essentially, it happens when changes occur in the DNA of normal prostate cells. These changes can develop during a person's life or be inherited from their parents. Here's a key fact. Inherited gene mutations account for up to 10% of prostate cancer cases. Genes like BRCA1 and BRCA2, often tied to breast and ovarian cancers, also raise the risk for prostate cancer. Meanwhile, acquired mutations happen by chance, as cells divide and replicate their DNA. These errors can lead to uncontrolled cell growth, eventually forming a tumor. Think of your DNA as a manual for your cells. When mistakes appear in these codes, cells may grow uncontrollably, resulting in cancer. But there's another side to it. Other unexpected factors can increase your risk for prostate cancer. Let's take a closer look. First, obesity and diet are major considerations. Men who eat a diet loaded with fat, especially one heavy in red meat and full-fat dairy, may have a greater chance. On the other hand, eating lots of fruits and vegetables could help lower the risk. Environmental exposures and lifestyle habits, such as smoking and drinking alcohol, also play a part in developing prostate cancer. Race and ethnicity matter too. African American men are at a higher risk compared to men of other groups. Plus, men with a family background of prostate cancer have increased risk. If your father or brother has had prostate cancer, your own risk more than doubles. However, simply knowing the causes and risk factors for prostate cancer isn't enough to guarantee safety from this illness. Let's discover the best methods for preventing prostate cancer. How to prevent prostate cancer. While there's no perfect method to completely protect yourself from prostate cancer, several lifestyle choices and health habits can greatly reduce your risk of developing this disease. Choose a healthy diet. Since you are what you consume, it's wise to follow a balanced diet filled with fruits, vegetables, whole grains, and lean proteins to support prostate health. Here's a helpful tip. Adding foods rich in lycopene, like tomatoes, and omega-3 fatty acids from fatty fish may provide extra defense. Maintain a healthy weight. Did you know that keeping your body mass index within a normal limit can decrease your prostate cancer risk? Losing excess fat and avoiding obesity can further enhance your odds of prevention. Stay active. Living a sedentary routine increases the risk for many conditions, including prostate cancer. That's why staying physically fit is so important. Aim to add regular exercise to your weekly schedule. Try to get at least 150 minutes of moderate aerobic activity each week to help reduce your risk. Schedule routine checkups. As noted before, one of the best advantages of taking charge of your health is the reassurance that comes from early detection and treatment. Speak with your doctor to determine the best time to begin annual prostate screenings based on your unique risk factors. Remember, early detection is essential for effective prostate cancer treatment and for maintaining a good quality of life. Don't dismiss the signals described in this video. Pay close attention to your body so you can respond swiftly if anything seems unusual. Be sure to arrange regular visits with your healthcare provider. Keep up healthy routines and stay aware of prostate cancer symptoms and risks. If this information was useful, please like, subscribe, and share this video with your friends and family to help spread awareness about prostate cancer. Now, here's a thoughtful question for you. What steps are you taking to stay on top of your health? Comment below and let's start a discussion. Gentlemen, if today's video helped you protect your health, your confidence, or your energy, you can now say thanks in a special way. Just click the thanks button below the video. Your support helps me share more tips that keep men strong and healthy well past 60, and I truly appreciate every single one of you.